Assessment. If the patient has two of the following three clinical features: tremor, bradykinesia, rigidity. Number 1, tremors is the most common presenting symptom in Parkinson's disease, 50 to 70%. Resting tremor at 4 to 6 Hz. Increases when walking, talking, or otherwise distracted. Most commonly affects distal upper extremities but may also involve lower limbs or chin. Number 2, bradykinesia, slowness or lack of movement, for example small writing, doing up buttons, or brushing teeth. Hypophonia and hypomimia, for example mask facies. Slowed velocity and reduced amplitude on repetitive movements, such as finger tapping. Number 3, rigidity. Increased resistance to passive movement. The resistance is consistent throughout the range of movement and is not velocity dependent, lead pipe, and if there is superimposed tremor this creates a sensation of cogwheeling. Patient complains of stiffness, aching, or cramping. Also suspect Parkinson disease if the patient doesn't fit the above criteria but has any of the 4S symptoms: slowness, stiffness, shakes, tremor, or stumbles, loss of balance. Features usually present asymmetrically. Although the other side is eventually affected, a degree of asymmetry persists. Assess for non-motor symptoms. Consider using a non-motor symptoms questionnaire. Check for later signs and symptoms which may include postural instability. Loss of postural reflexes can lead to instability. A slight perturbation may result in falls. Gait disturbance. Early features may be the dragging of one leg or a stooped posture. Festination, or the sense of the feet wanting to rush forward in a running motion. Freezing of gait or gait ignition failure, where the patient has a feeling of their feet being stuck when trying to turn or move through narrow doorways. Gait remains narrow-based. Speech and swallowing problems. Review the warning signs that are not typical for idiopathic Parkinson's disease and consider differential diagnosis for Parkinsonism. Warning signs. Early onset of postural instability and falls, dysautonomia, and dementia. Symmetrical presentation. Relative lack of tremor. Poor response to L-DOPA or dopamine agonist medications. Presence of other neurological features, example, cerebellar signs, pyramidal signs, cortical signs, aphasia, apraxia, or cortical sensory loss.